So good afternoon. I am Andrea Russo. I run my private practice in Brescia, Italy, and I'm mainly focused on cataract and refractive surgery and technology. This is why I'm here with my friend José L. We were discussing some technology, some hot stuff that we just discovered this afternoon. Why don't we start with your presentation, which is about a terrific slit lamp?
Thank you. Thank you. I am José, by the way. I am José Güell. I'm working in Barcelona at IMO and very much involved in Lightfield technology because as I tried to explain in my presentation, we have incredible instruments to evaluate the eye. Like especially the posterior segment, like the optomap or like different OCTs. We have also incredibly good instruments to evaluate the anterior segment of the eye, like topographers, OCTs, but we always rely in our evaluation of the slit lamp. And this is almost impossible to be substituted. So if I want to send you the information of a patient that I have in mind and that has an anterior segment inflammation, and I send you a simple single image of the slit lamp, you won't be able to really understand what is happening there because you need to explore the patient. So that's the missing step of the full eye exploration if you want to store it. So I really think that to have a slit lamp a slit evaluation able to be performed by anyone because it's the machine that is doing the evaluation, and that you have this video in your hands to later on evaluate, to send to you, or to I think is really a step forward in ophthalmology.
Yes, this is something we are missing. So it's an unmet need so far. So I had a question for you I didn't ask before in the interest of time, but my question was, do you believe it will be possible sooner or later to make it robotic, automatic? I mean, it's me, maybe in another country, moving a joystick or something like that, which is connected to motors in the slit lamp.
Well, one of the good things, I understand your question, but the good thing is that you don't need that because it's already the exploration being performed automatically. The only thing that you will need is to have someone measuring the height of the position of the chin in the front as you need for any other exploration. So as long as you have someone going there, your patient is going there, the exploration is being done automatically. So from answering to your question, of course, you will be able just to say, go, and then you will see the slit lamp exploration as you have programmed. Because another good thing is that it is not the same, the movements that you're going to do at the slit lamp if you want to evaluate the lid or you want to evaluate the anterior chamber because of inflammation or trauma, or the cornea. So you may have different programs.
So it's already robotic. It's already programmed.
Robotic.
Okay,
Yeah.
okay. Well done. Great.
Which I think is good.
Perfect. So moving to other topics, I believe that data is a common denominator, not in the future, in the present, because without data, we don't have the power. Data, I believe, is the new oil. So it's a challenge to extract the data from the equipment, which is the same challenge like extracting the oil from the ground. And the second challenge, which is probably the most interesting part and funniest part, is to refine the data exactly as we refine the oil. So I was impressed by the presentation that is able to connect to the cloud all the data which is coming in the practice to provide assistance to the doctor. So I'm really passionate about this topic because, of course, on a smaller scale, this is what we have done in our practices. So all the equipment is connected in real time to the cloud, which is collecting, aggregating all the data. And there is an algorithm which is suggesting the surgeon whether the patient is a good candidate for any kind of surgery or not, and which procedure is the best procedure for that specific patient. So we did because it was another unmet need in our practice. So I love the topic. And the challenge will be to develop this idea as a product, because so far it's a tailor-made system according to our needs. But what is missing is the easy of interconnection between every station. Think about the IOL Master, the Pentacam, the MS39, the HD analyzer, the whatever. So we are missing the interconnection, an easy interconnection between the devices and the cloud. So you need a lot of turnaround, a lot of engineering work to connect physically every station in order to send the raw data to the cloud. So what is your opinion about this?
I think that we are already there, as you mentioned. We already have, in fact, we already have the ceiling, but we do not have the base of the house. I mean with that once we have been able to have all this data in the computer, the work that the computers or the robots or however you want to name them are going to work with this data. We already have that. The problem, the practical problem, is that you might have the Pentacam, I might have another topographer, or I might have two, and I want to use both, and the other has another unit. And so it's similar to the iPhones or the cellular phones, I mean, or the
Android
with different plugs. No? So I think that this should be not only a work of a company, or it might be a combined work. We need to have this ceiling working companies like the one that we have seen today, but also I think that we have to have an effort from all the providers of units, making easy for the ceiling to be connected with the base. Because if not, we have the possibilities to do it, but we have not the way to connect.